Good morning, everyone. I'll get started then. I'm Sem, and I'm a coordinator at the Health and Wellbeing in Planning Network. It's really lovely to see everyone here today, and thank you for joining us this morning. Just a quick sort of overview of what the network is, because we're doing this event alongside Natural England, which we're absolutely excited for. But the Health and Wellbeing Network is connects over 250 professionals working at the intersection of planning, public health, and urban design across the UK. We're a community of practice championing healthier places through knowledge sharing, policy advocacy, and collaborative action. So if you haven't joined already, we would strongly encourage you to join our network. So please do use the QR code here to join. And before we dive in, a few quick housekeeping points. We'll run the keynote, which we have Andy and Anna doing from Natural England, and we have 4 case studies across the country back to back, and then open it up for questions and discussion at the end. Please do pop your questions in the chat as we go. I'll be keeping an eye on them, and we'll gather them up for our Q&A. And if you're having any technical difficulties, please drop me a private message in the chat and we'll try and sort that out for you. So, just a quick agenda, going through the agenda. As I mentioned, we'll have a keynote from Andy Smith, who's the Deputy Director, and Alan Collins, who's looking at the LNRS strategies from Natural England. We'll have case studies from Mike, Sam and John, Stuart and Warren. We'll open up panel discussion after that with a Q&A from the audience, and then we'll go into breakout groups, which will give us an opportunity to discuss and reflect on what we've shown you, and also hopefully open up a really interesting discussion on what is going on in your reflective area and how you could really systematically integrate health all across the board. So as many people in this room know, local nature recoveries strategies are nearly all published. I think what excites me most about today's session is that since they've nearly been published, we'll be hearing from people who've been working at the strategic level as well as at the implementation level, navigating that messy, creative and often challenging reality of bringing different teams and departments together around a shared agenda. LNRS are at their heart a collaboration challenge. They ask us to think across traditional boundaries, and to quote a colleague, Warren, I hope you don't mind me quoting you here, but in planning we often let biodiversity and habitat take centre stage, yet the landscapes we shape also hold quiet power to cool our cities, clean our air and heal our communities. Nature is not only a refuge for wildlife, but a vital ally for human health and climate resilience. When we remember to design with people and planet in balance, landscapes become truly transformative. So we're really incredibly fortunate to have Natural England setting the scene, and followed by these 4 case studies that each bring a different perspective on how cross-sector collaboration is playing out in practice. I want to extend my thanks to Natural England, the Town and Country Planning Association, who is supporting us today, and all our speakers for making today happen. Now I'll hand over to Andy and Anna, who will be giving us the keynote. So Andy, over to you.
Brilliant. Thank you ever so much, Sam. Hello, everybody. I'm Andy Smith from Natural England. I work in our strategy group. I wish Sam hadn't said at the beginning of the call that there's over 100 people on the call, because I can currently see about 5 people, which is slightly less intimidating, but it is wonderful to have such a great turnout, such an illustrious audience for such an important subject. So I'm really pleased actually that the numbers are so high. That just demonstrates what a strong interest there is in this subject, and what an important opportunity it is right now actually to get stuck into this subject and make the most of our local nature recovery strategies. I work in Natural England. I work alongside Anna, who's going to be speaking in a moment alongside me. We've got about 20 minutes between us to really sort of make the case for this being an important opportunity right now, specifically about the interconnection that there is between nature and health. And I know that I'm sure everybody on the call gets that, knows it, and totally appreciates the benefits there are from having an improving natural environment upon people's health and well-being. But what we perhaps can do today is just bring that to life a little bit, provide some of the background, some of the evidence, and some of the tools and the mechanism to help make that case, and particularly demonstrate how local nature recovery strategies are a game changer in this world. Now, Anna and I and others on this call, I know, have been living and breathing local nature recovery strategies for a long time. And we know how really great they are, and the quality of the LNRSs that are coming through, that are being published, are really strong. They are clearly documents that have had a lot of investment of time, effort, and they have that local engagement, which makes them really credible documents in terms of setting out what the local priorities are. So we must use them now to the full effect to make sure that the impact, the power of those local nature recovery strategies are fully realized. And that's what we want to sort of help do today, is to really bring it to life and demonstrate how they can have multiple benefits, particularly if they are embedded in the planning system from top to bottom, through spatial plans through to local planning decisions, that they influence those decisions, and that they bring out all the multiple benefits there are to be gained from the detail that's within those local nature recovery strategies. So on to the next slide, please, Sam. Just to say a word about Natural England, I'm sure that you know that we are part of DEFRA group within government, part of the Department of the Environment. We're an arm's length body from government, which gives us a degree of independence, but we are the government's statutory advisor on the natural environment. Our remit is to ensure that sustainable stewardship of the land and sea, so that people and nature can thrive. So although natural environment is absolutely key to our work at Natural England, as you would expect by the title of the organisation, but we do place a heavy emphasis on making sure that nature is relevant to people and to people's quality of life. Those two things go hand in hand. And at the end of last year, in November, Natural England launched our new strategy, which is a long time in the making, and a lot of thought has gone into that to really set our stall out as to what we are as an organisation and what people should expect from Natural England. So we are about recovering nature for growth, health and security. That's the title of our new strategy. So it's not just about recovering nature for nature's sake, it's making sure that all those wider benefits from nature are realized, and often leading with those other benefits, often leading with growth, leading with health, leading with national security as being the objectives, and how nature can help deliver those really important outcomes. So those outcomes are described here on this slide: recovering nature, building better places, improving health and well-being, which is a bit of a focus for today, and delivering security, like food security, energy security, those natural resources that the nation relies upon so much. So nature underpins all of these strategic outcomes. On to the next slide, please, Sam. This wheel here really demonstrates how much we depend upon nature for many, many aspects of our life. Nature is not in good shape at the moment. We know that, don't we? We know that all the graphs and the statistics that we look at pretty much demonstrate that nature has been struggling for many, many years now, despite our best endeavors to try and help turn that around. But the challenge for us, I think, is to try and flip that story completely and say, well, all these things that depend upon nature, if nature's not doing well, they will suffer. How can we flip that to demonstrate that if nature is actually prospering and thriving, all of these other things that depend upon nature will benefit? And that includes these cultural aspects down in the left quarter here, that those cultural aspects in terms of our day-to-day life, the economy, our health and well-being, the quality of life that really matter to people, as well as supporting all those other aspects of the ecosystem that are so dependent upon nature being in good shape. And the challenge we face, of course, is that there isn't a huge amount of money. There's much competition for the money that is available. The challenge we also face is the pressure upon land. We're a small island, and there are many competing demands upon how land is used. But how do we make sure that in and amongst those competing demands, the case for nature is proven, and that we use nature to help deliver those other land use priorities as well, whether that might be about housing or farming. There's certainly a case for nature in helping to deliver great outcomes in those objectives as well. So we can see that nature is actually part of the solution. I think that's the point I wish to make using this particular slide here. On to the next slide. I think you'll have seen many different versions of a diagram like this, which is to try and show in a picture what we are trying to achieve, what the ideal looks like for nature. That we're looking to achieve a coherent network for nature, where it joins up and it allows nature to prosper through having places where we've got those really ecologically prized places where habitat is really rich. And between them, nature can prosper through those corridors. If we think about how we actually plan it in a well-structured, strategic kind of way, but thinking about how this then really matters both to people and to wildlife. We are still very much working to the Lawton principles, which he published in his report in 1910, of providing for nature in a bigger, better, more and more joined up way. That's certainly our driver, and it has been for many years now, and underpins all of our work. On to the next slide, please, Sam. This is a recurring theme for the presentation that Anna will be making today. So you might see a similar wording in other slides yet to come. But LNRSs, now that they're starting to hit the streets, they give us that evidence of what really matters, where the opportunities are local. They give us the map, literally the map of where the priorities are, that people say there are the opportunities to improve nature, which really matter to people locally. So that we don't assume that we know best. We don't try and deliver the same thing everywhere. We respond to what the LNRSs are telling us. Nature and health are part of the outcomes. There are many outcomes to be realized from delivering our local nature recovery strategies, and health and well-being and nature, of course, and many others are the outcomes. And the planning mechanisms give us the levers, the tools by which we can make sure that the LNRSs are being put into practice. That's where the big decisions happen through our planning system, the big opportunities are. So I'm going to hand over to Anna now, who's going to talk about LNRSs in a bit more detail, where we've got to and what they start to look like. And then I'll come back in to sort of reinforce some of the points that I've made already. Anna.
Thanks, Andy. Right, so I am going to just rattle through quite quickly a set of slides that are mostly just to bring us all up to a baseline understanding about local nature recovery strategies. So in simplest terms, as Andy's already described, they are documents which tell us how and where to prioritize our efforts to recover nature to secure the best outcomes. Oh, next slide, please. Sorry, Sam. They have their own geographies. Sorry, I'm slightly thrown because I haven't got the view where I'm looking at you all, where I can see the slides. I don't know how to get back to that. Okay, I'm going to have to bear with me a second. Okay, there we go. Sorry, go back a slide, Sam, now that I can see the slides. Okay, so in simple, so they have their own geography, so you can see they're 48, but are closely aligned to local government boundaries and likely to track the further changes coming through devolution. This is to make them as easy as possible to be used by local government and for those geographies to be something that people are familiar with. Collaboration, their collaborative produce is really critical, and it represents a step change in nature decision making and establishes a principle which will benefit the kind of things that we're interested in terms of aligning delivery in such a way that it's delivering outcomes for people and health as well as for nature. The reason I say it's a step change is because it's been really given that opportunity for a breadth of voices to be involved in nature planning. That's not necessarily something that's historically happened, and we hope that will strengthen the quality. We hope it has strengthened the quality of the LNRSs that are out there and the ones still to come, as well increasing the sort of value and utility of LNRSs. The wider the breadth of sectors that are involved, obviously the greater, well, we hope the greater the likelihood of those sectors being able to use the strategies. Each strategy targets action by agreeing the priorities for nature's recovery and mapping those proposals for delivering those priorities. Right now, next slide. Thanks. So just very quickly, a few screenshots from the Northamptonshire LNRS, just to illustrate some of the points I was just making about kind of key features of the LNRS. So you can see the map on the left there. And then on the right, so that's showing you the the priority locations for particular activities. And then on the right, showing you I know it's quite small, but just what's illustrating here is that for a particular location, there's an illustration of the activities that are best achieved in that location. Next slide, please. Oh, just to say in terms of what you saw on that previous map, that's an entirely common feature of all LNRSs. You will see in all LNRSs there'll be a map, and there'll be which shows you the best locations, and then there'll be an indication of what the activities, the best management that's for those locations. So just to hammer home the point, there are features built into LNRS that make them really powerful decision-making tools to coordinate and target action that delivers for nature, and therefore hopefully thus deliver for people and nature, for health and nature. LNRSs are built through collaboration and local ownership, as I've already touched upon. They draw upon the knowledge of local people who understand the places best, and they give delivery partners shared ownership of priorities, making them more realistic and more deliverable. They do provide those spatially targeted actions, as I've just talked about. And then the last point here is that although LNRSs are strategies for nature recovery, active in the process was the encouragement to think about the other environmental benefits that natural habitats can provide to society, which is what creates the opportunities that this session is all about. Next slide, please. So just briefly to touch on delivery. So it's a critical stage in the LNRS policy journey. With most local nature recovery strategies now published, we are entering a new phase for LNRS policy. DEFRA is planning to fund local authorities, fund those local authorities who led in the preparation of LNRS, to fund them into a kind of delivery coordination phase. And the list here just illustrates the expectations that DEFRA are likely to set. They're in active discussion with those responsible authorities now, those local authorities now, about the scope and breadth of that job. But you can see, broadly speaking, what it involves, and we can come back to that if people have got more questions. Right, next slide, please. So the planning system is really critical. We're obviously in the midst of lots of activity around the planning system. With most LNRSs now published, they are available to be a really critical evidence base for the planning system, which should be a game changer. There are a number of policy connections between local nature recovery strategies and the planning system. So some key points to clock here: that all LPAs had a formal sign-off role in the preparation of LNRSs, and we can expect that role will continue in future iterations of LNRS. So that's really provides us that great link between the two and the two systems to speak to each other. Planning authorities, as of next week, will have the strongest duty on them in terms of the duty on all public bodies. Currently, they are bound by the duty to have regard to LNRS, but as of the 25th of March, they will have to take account of LNRSs. And I'll talk a bit more about that in a second. And these duties obviously build on and complement the existing NPPF National Planning Policy Framework expectations to think about wildlife-rich habitats and ecological networks. Next slide, please. So, as I've already touched upon, so LNRSs are, in all those locations where we have published LNRSs, we have a fabulous evidence base that will tell people very clearly and unequivocally what the best things, the locations for that are the priorities, and also the best things to do in those locations. And we've had bits of bobs of that in the past, right? But we will have it everywhere, which will be an amazing platform to build on. I've talked about the strength and duty, and we're expecting further detail through the planning policy guidance on plan making and the natural environment, which will set out more about that take account duty. Listed here is a reference to environmental outcome reports, which we know are on their way, as a revision of the current system of EIAs, environmental impact assessments, and also of strategic environmental assessments. There's other initiatives coming down the track: Nature Restoration Fund and environmental improvement plans. The acronym has slipped my mind, not environmental improvement plans. I'll come back to that, but other initiatives coming down the track. And there's also various bits of funding that have links to growth and development So I've just talked about Nature Recovery Fund. There's obviously biodiversity net gain and other initiatives coming. Next slide, please. Lastly, before I hand back, environmental development plans. It sounded wrong when I said it. EDPs, that's what was slipping my mind a second ago. So just briefly want to touch before I hand back to Andy on the huge opportunities through devolution. I mean, what's critical is obviously we're going to have new strategic authorities coming down the track, and we expect local nature recovery strategy geographies to follow those, and as well as the establishment of the requirement for spatial development strategies. The strategic authorities herald a really exciting devolution of power from the centre, including devolution of environment and climate. Environment and climate is one of the 7 functions that these new strategic authorities will be expected to take on. And LNRS in the first instance is one of the main ways we expect strategic authorities to exercise that function. It's an environmental power, obviously, that's already devolved to local authorities. So we can expect that activity to continue. All areas will prepare a spatial development strategy to guide development, and mayors will also be responsible for preparing their local growth plans. And this all sits alongside, as you probably all are very keenly aware, a new legal duty on health, which means strategic authorities will have to have regard to improving health outcomes and addressing health inequalities. And there's a massive opportunity that's created by this in terms of opportunities for health and nature delivery. These new councils will want to make a statement, show their intent to deliver better places for their community. So huge opportunity for us all coming from devolution. And I will hand back to Andy.
Thank you, Anna. So I think that last point you made is particularly important, isn't it, in terms of timing, with local nature recovery strategies beginning to be published at the same time that new councils will be forming. So there's a real opportunity to get off on the right foot, isn't it, in terms of them embedding LNRSs into what they are as a new authority, and perhaps that being a statement of their intent. Yeah, on to the next slide, please, Sam. Very aware of the fact that we've only got 20 minutes and we've got so much that we want to say today. So I'll scoot through these slides really quickly, make sure we don't run over perhaps other than by a minute or two. And perhaps you could read the slides on the recording if you listen back later. But this slide really is just to demonstrate that clearly there's a lot of evidence out there that helps make the case that delivering nature improvement, putting our LNRSs into practice, will give great outcomes for people's quality of life and their health and well-being. As health systems are moving and shifting as much as they can from treatment and responding to health problems to tackling health prevention in the first instance, then that's where nature really comes into its own. And that report there is just one example of the many pieces of evidence that you can refer to help make the case for nature in terms of health. And of course, that ultimately leads to a great saving in public expenditure. And just to drop in one survey from the 2025 People and Nature survey, it was found that 93% of 18 to 25-year-olds said that being in nature made them feel very happy. And that's a really simple statement, but you can see how that fits very clearly into a couple of those boxes on the slide there in terms of nature activities improving mental well-being particularly. So I think there's lots of useful information that we have got that we can make available in helping to make the case for nature. Thanks, Sam. The next slide. And the purpose of this slide really is to say that when people are involved in nature, then people can be good for nature. So nature is good for people, it's good for quality of life, but when people are involved and working with nature, they place a value on it, which in turn leads to that sort of continued investment in nature. So it's a really great circle, really, that investing in nature is good for people. And when people are engaged in nature, it leads to good results and further improvement in nature itself. And we work across government to support educational benefits, to those community and social benefits. And all the evidence demonstrates that when people are active in nature, it builds social cohesion and greater and better communities. Thanks, Sam. This is just one really good example that Natural England, amongst many other the organisations that are listed at the bottom of that slide, are involved in green social prescribing. So self-evident what that is in terms of doctors, GPs now prescribing time in nature rather than prescribing drugs in terms of tackling health problems. Some really useful information on the screen in the green box there, perhaps to come back and look at if you have more time to watch the recording or when the slides are shared. But Natural England has been involved in testing out this approach with GPs in recent years. And now we are about to produce an evaluation report which demonstrates the case for prescribing nature rather than medicines. And our focus now, as it says at the bottom, is now to scale this up and start to see this spreading across the country, and more general practitioners, doctors prescribing nature to people as the best form of treatment. And another statistic is that the Office of National Statistics suggested that of every pound invested in nature, there is a return of £2.42, the social return, the benefits, the savings that it makes to the health service and social problems. So again, there's some really good statistics to call upon. It's worth remembering that 1 in 8 households have no garden, and a study recently suggested that every additional 360 meters you are further away from green or blue space, it's linked to a 5% higher risk of anxiety and depression. So if you're further away from access to a green space, it is more likely that you will suffer from those things. On to the next slide, please, Sam. This is just a very quick slide just to flag a very useful resource in terms of guidance and tools, mechanisms that can be used for nature and health. Again, that link will be available in the slide that you can follow at a later date, but there's lots of useful information on the Nature for Health Resource Hub. On the next slide, please. So this is a slide just reinforces about integration. It's about all the systems working together, local nature recovery strategies, providing the evidence, the map, where the opportunities are, bringing this together where the health needs are the greatest, where the greatest inequalities in health are, and using the planning tools as the delivery mechanism, where development is happening, regulation is happening in the planning world, bring that together with local nature recovery strategies, the health inequalities, and that's where it all integrates to bring you the very best possible outcome for improving nature, but particularly improving people's quality of life. Many diverse funding streams are available, as Anna said, and lots of opportunities through the planning reform that's happening at the moment to really make the most of those. And the next slide, please. So this slide, just very quickly, it says, well, where these 4 boxes set out how LNRSs provide the details of where the benefits can be made and the health opportunities as well. They set out what actions can be taken, the LNRSs detail the actions, the interventions that can be made, planning policies where it's built in that sort of more strategic way. It's a list of all the different partners, and there's many more organizations that have a stake in playing a role in putting LNRSs into practice. And the how is the different programs, the projects, the planning tools, etc., that can be used to deliver those things on the ground. And our ambition is to bring all the things together to deliver the best possible outcomes. On to the next slide. And that just simplifies, this slide just simplifies the last one, really, is saying that LNRSs provide you with the evidence, and the nature-based interventions are the tools that we can use to deliver those environmental improvements, which deliver health benefits. And as I said previously, once you are improving the health benefits, making that case, demonstrating the outcomes, then that in turn leads to more investment in nature. On to the next one. So LNRSs are the unifying framework, bringing together the planning system, health, and the well-being agendas. They can influence planning policy. In fact, they have to influence planning policy, as Anna said, in terms of having to have regard to LNRSs in the development of those policies and shaping where intervention happens, embedding nature in the spatial solution using tools like biodiversity net gain and green infrastructure planning, using LNRSs to influence where money is targeted, where it can have the greatest environmental and community impact. And the LNRSs, it says towards the right of the screen, help steer and influence delivery on the ground through the programs, partnerships and projects, and through developer contributions. Along the bottom, there are so many other strategies that they need to have regard to, bring into the mix the wider strategies regarding sort of transport and climate adaptation, air quality strategies are all part of that envelope of things that need to be taken into account that local nature recovery strategies can have an influence on. leading to healthier, more resilient places. So the LNRSs provide that spatial framework to guide health decisions, environmental planning priorities, create healthier communities and a better quality of life. On to the next slide. Just one very quick example, just a flag where Natural England is working with the National Trust and the National Lottery Heritage Fund, really high profile project with quite a considerable amount of investment behind it, working with local authorities to deliver health outcomes through nature within the urban setting. And the ambition, as you can see, by 2035 is that 10 million people benefit from local green or blue spaces being improved for nature. So that is a very current example of one of the many projects and programs that are using LNRSs to help decide what really matters locally to make the right decisions. And on to the next slide. In Liverpool, just using their local nature recovery strategy is a really good example of working with local partners. The LNRS has clearly been developed with local partners, including the health sector. And the actions that have been identified are to connect people with nature and the urban environment. Liverpool has received Nature Towns and Cities money from that previous program I mentioned, so that's where it's coming together, investing in green infrastructure in their green and blue, their water spaces within the city, delivering multiple outcomes. And we're going to hear about many other examples of local nature recovery strategies today from other speakers. So just getting towards the finish now. The next slide, please, Sam. So all 48 of the local nature recovery strategies are going to be produced this year. So as we said earlier, they're mostly now all published, and we will see all 48 done by the end of the year. Natural England has an ongoing role in supporting the implementation of the LNRSs. We are absolutely not stepping away from this. Many of you would have been at a conference in Leicester a few weeks ago, where we had over 200 people in the room. Nearly all 48 responsible authorities were well represented there, and the energy and the enthusiasm in the room to really own your local nature recovery strategy and put it into practice was really evident. And Natural England has got an ongoing role to make sure we maintain the momentum of that support, energy and enthusiasm for LNRSs, but making sure that we bring our health colleagues into it so we get those maximum benefits and recognise nature is part of the solution. So we will continue to work with the health sector, we'll continue to work with planners to ensure that LNRSs are embedded into those important planning mechanisms. Just to flag at the bottom there, the Explore framework, which is recently launched this month actually by Natural England, providing the evidence and the tools and the facilitation resources to make sure that nature is embedded into local decision making at the earliest possible stage. So do follow that link that's in the slide there. But if you search for that Explore framework, you'll find it on the local partnerships website hosted by the LGA. Some really useful tools there about how to make sure the case for nature is made at the earliest point in the planning process. And the final slide, Sam, I think, yeah, it's just to summarise what we said a couple of times really. LNRSs provide the map, planning gives us all the levers, and health is one of the many outcomes from delivering local nature recovery strategies. The opportunities are provided by the change in land use, so developers and landowners are absolutely key partners in part of this overall plan. So thank you. I hope I haven't run it too much, but there's a lot to say there. Thanks.
Excellent. Thank you so much, Andy and Anna. What a brilliant way to start off today's session. And it gives us really a rich foundation for the conversations ahead, particularly liked, LNRS map being the map, health being the ultimate outcomes of, the planning system. If you really bring together all the levers in an appropriate way. And I think that really sets the scene for what we're trying to grapple with today. So over to Mike, who's the Natural Capital Programme Manager at West Midlands Combined Authority. I just wanted to double check Mike's in the room.
Yes, I'm here, Sam.
Finally got you in the room. We've had a bit of an issue in terms of getting people in. So just as a quick note, because we are at max capacity at 100 people, we are recording the session. So if there are any colleagues that are trying to get in the room and are unable to get into the room, we will be issuing a Zoom a recorded version of today's presentations, and if possible, just so that we can keep track of who wants the link, if they're able to join the Health and Wellbeing in Planning Network, a link which we can send around later as well. We'll be able to send it around through that one channel, and people will be able to receive a recording. I hope that's all right with everyone. And thank you so much. Mike, over to you.
Yeah, thank you, Sam. It's been a somewhat fraught half hour, but I can at least now claim I've been part of a sellout tour. So that's good. That's
No,
good.
thank you
That's
so
good.
much for
Good to be
joining us.
Thank you. Sam, are you driving the slides on this one?
Yes, I will be. So just let me
Brilliant.
know
Yeah.
next slide when you're ready.
Yeah. Next slide. Right. Yeah. So biodiversity. I'm not sure what Andrew's already addressed, but biodiversity in England is not in a great place. We've lost a lot to the point where we're now recognised as being one of the least biodiverse nations in the world globally. So we are extremely nature depleted. And I think part of that is we're a small nation, a lot of people living within that space, and we've got a lot of land use put down to agricultural use, which has an important role. But through that, we've seen degradation of nature. So we'll move on. Next slide. But nature's not just about the flora and fauna. It actually performs a much more important role for us and for society. And these are just press releases in the last couple of months, of just this year. So these are really current. So we had at the end of 2025, it was confirmed that last year was a record-breaking year for heat. You know, we are getting warmer, we are getting wetter. The climate is definitely shifting, and nature can play a part in addressing that, but also nature is impacted by that as well. We've also had an assessment undertaken that kind of slipped under the radar a little, didn't get a high level of attention, but this was prepared by the government, not Natural England, but more by strategic parts of the government looking at security. And they assess that nature is a foundation of national security. So we've got some real risks and pressures there if we continue to lose the nature we've got. And they use fairly dramatic phrasing like ecosystem collapse just in the title. It's a short report. It's worth a read. It's quite sobering. It's very, very sobering. So it just kind of shows how important it is that we start to act. And then, of course, we've got Prince Charles, who's always been a champion for this topic, but he's talking about the way nature's important for the economy. And we've seen reports recently showing that if we continue on the same track we're on currently, we have a potential impact on our GDP, so our economic performance, of about a 12% decline. Now, bear in mind, the GPD dropped 8% when we have had the COVID pandemic, and that was short term. 12% is potentially quite a significant hit, and that's down to continued depletion of our natural resources. Next slide, please, Sam. So what's the LNRS? So the local nature recovery strategies came about on the back of the Environment Act in 2021. And in essence, they're spatial strategies for nature and environmental improvements. And it's important that it covers a little bit more than just nature. So in essence, the first stage of this is looking at how we describe the region we're working in. So it's about understanding the baseline of that LNRS region, and then identifying what's really important for nature, because each place has got its own little quirks and character. And it's important we pick up what's relevant to that local setting. We then look through extensive consultation and engagement at what the priorities are for nature recovery, but also how we can engage with nature to achieve other environmental outcomes, which is particularly important with the topic of today's talk around that well-being and health kind of outcome. And then we look at the actions. They're often called measures within the LNRSs as to how we actually deliver that. And of course, we go a step further to map proposals as to where we need to deliver those measures or actions to get greatest impact. And those are priority maps, in essence. That's where we should be focusing efforts. And again, in terms of preparing plans and strategies, those plan makers currently have a duty to have regard to the LNRS, and that will be strengthened as further legislation comes through to take into account, which is a little bit stronger. Next slide, please. And this process, this LNRS system is split around the whole of England. There are 48 of these local regions, and they're typically at a kind of county or combined authority level, so you can kind of get a feel for the scale of these. And they all abut each other. They're all lined up. There are no gaps. They all join up. We get full coverage through these 48 LNRSs of the whole country. And though they are focusing at the local level in terms of what's important in that place, they all join up and they all merge to form the National Nature Recovery Network. And through that, there will be common themes and linkages, and we will see nature recovery at scale across England. And that will then help us to achieve the targets we've got in the Environmental Improvement Plan. Next slide. So coming back to my patch where I'm based, so I'm in the West Midlands, and the West Midlands for me is a combined authority area. And this includes a very urbanised core of the region. We've got the 4 Black Country authorities to the west. We've got Birmingham, which is the big chunk in the middle. We've got Solihull and we've got Coventry. And within that area, we've got nearly 3 million people living there. So it's very heavily urbanised. The landscape has been changed. And what's interesting here, when we start to probe into the coverage of that landscape, we're finding that almost 60% is urban and suburban, so it's garden or built-up areas. And that's represented on this plan through the grey and that kind of pale green sagey colour. So you can see the extent of that. But oddly enough, we have got some real quirky things that are positives for us. We've got 149 miles of canal in the region, and they provide networks and connectivity running through the region. And as ever, I have to mention, we've obviously got more canals than Venice. It's something we always have to say in the West Midlands. Tree cover's an interesting one. So we've got over 14% across this region, this heavily built up region. That's actually greater than the average across the rest of England, but not all is equal with that. And I'll come on to the reason for that later. So next slide, please. Yeah, so nature, particularly in the context of health and well-being, starts to have other benefits and play other roles in our society. And this is exaggerated even further where we've got this huge population in the West Midlands. And the first one I wanted to touch on is that accessibility to nature. So the map on the top left there, the red bits are where we've got a lack of accessible nature and lack of accessible green space. And you can kind of see they're in the really heavily built up parts of the region. And what we're finding is that if more people had access and were utilising that green space, there could be over 2 billion of savings for healthcare across England. Those are the national figures. But in the West Midlands, we're finding that we've got lower life expectancy, and we're right at the bottom of Natural England's tables for accessing green space. So we're not in good habits, and that's probably down to those red areas as well on the map where we haven't necessarily got easy access to green space. What we also find is it's not just that accessible space, it's tree canopy cover. There's some fantastic data on tree equity that is available now. When you start to look at that, those impressive figures of 14% across the region present a kind of overview that is a bit distorted. So if you look at that little map insert, you'll see the green stuff to the southwest there. That's around Edgbaston, absolutely beautiful community at the top end of the scale in terms of people being affluent and better off. So you've got big Victorian houses, nice big gardens, tree-lined streets. The tree canopy cover in that part of Birmingham is about 36%. It's virtually a woodland. And with that, you get all those benefits. You travel 2 miles north to Blazelles, the community where Benjamin Zephaniah was, and you've got a much more built-up area. You've got 3 or 4% tree canopy cover. And typically, what we tend to find is there's an association between those communities of greater deprivation where you get less tree cover. And also those communities have less ability to actually be mobile, to access green space, to go to places that are maybe less inclined to suffer from extremes in weather. And coming on to that, in terms of the climate, we know things are getting hotter and drier in summer and wetter and warmer in winter. And what we've done at the WMCA, we've done an awful lot of mapping of where the impacts will occur, but also layering that with vulnerability. So we start to look at where the communities are maybe less able to respond or adapt to this. And lo and behold, you see where the hotspots are for impact and vulnerability. They do also relate to where we've got a lack of green space and where that tree canopy cover is a little bit lower. So we're starting to see that link between deprivation and typically lower health in those areas where there is less of the green stuff. So just a few things from the 2022 heat wave, which was probably only a week, 2 weeks long at maximum. We saw across the UK over 3,000 excess deaths in that period, and a fifth of UK hospitals had to cancel operations over a period of a week, and that was actually down to systems struggling with the heat there, and in particular data centers really struggling to cope and not having access to those computer systems. So there was a really strange knock on there. But what we do know on the positive is that over a third of our climate adaptation needs can be met with nature-based solutions. So we can start to deliver.
He's frozen.
Yes. I was just going to check if that was the same for everyone else.
Yeah, we've lost him, sadly.
Oh, no. Mike, can you still hear us? Perhaps not.
I believe he's actually gone off the call now. I'll just check the list. So how far was he in the presentation? It might be worth seeing.
He still had quite a lot to go, but we had 5 minutes left. What we can do is perhaps move on to our next presentation from John and Sam. If that's okay. John, Sam, is that?
Yeah, that's fine. Yeah.
Because it was just getting quite crunchy because I thought it was really interesting about the point about vulnerability. I wanted to actually ask him about that, but maybe we'll come back to that towards the end. So we have Sam Evans, who's head of Natural England, head of Natural Environment at the Combined Authority, and John Mint, who's Programme Manager from NHS Greater Manchester Integrated Care. I'll just quickly come up to your presentation and over to you, Sam.
Great. Thanks, Sam. Hi, everyone. I'm Sam Evans, Head of Natural Environment at Greater Manchester Combined Authority. John and I will do a bit of a double act of hopefully around 7.5 minutes each. So I'll give you a bit of, try not to repeat too much of what Mike said in terms of our local nature recovery strategy, and then John will get into a bit more of the detail about some of the programs and projects we've had going on to sort of from a health perspective. So if you go to the next slide, and again, so yeah, a bit of a summary of what I'm going to talk about in terms of partnership working, planning, delivery, learning and barriers, and future plans and for our local nature recovery strategy, which we published last September and was the first published strategy across the north of England. A really important document for us in terms of setting out our ambitions for nature recovery, in terms of the vision for what we want nature recovery and GM to look like. We've got some aims in the strategy, and for us, really importantly, we've got some quantitative targets around what we want, what changes we want to see, including some of the things Mike mentioned around tree canopy cover, but also in terms of the sites that are designated and protected for nature and people's access to nature as well as the end results we want to see from the strategy and practical actions that can make a positive contribution on the ground to doing that. So if you go on to the next slide, here are our targets that I was talking through and our aims. And we are really focusing on these in terms of delivery of the strategy. So some around sites that are designated for nature, creating more wildlife-rich land, increasing the amount of accessible green space for residents, and then building resilience as well. So tackling some of our challenges around water management and increasing tree canopy cover as well, which we know will be really important for tackling climate change. Next slide. So the strategy also has a spatial element, as Mike mentioned. So this is from our strategy, sets out areas that are already good for nature in dark green and where we should be focusing our efforts for nature recovery opportunities. There are also other maps in the strategy, because obviously this doesn't necessarily then map into the urban areas. So we've got some additional information in the strategy setting out where within our town and city centres in the centre of Manchester and Salford you would really want to focus to deliver all of those wider benefits that we know action on nature can deliver. So bringing in healthcare data or climate resilience data. So yeah, we build on this in the strategy to set out where in the urban areas we should be focusing action as well. Next slide, please. Bit of a zoom in of our nature recovery opportunity areas that set out for different habitat types where action is possible and most beneficial for nature recovery, and lots of sort of platform online that allows you to interrogate these and really understand what might be most beneficial in particular locations. Next slide, please. And it does that across a range of different the range of different habitats that we see in Greater Manchester. It's not just our urban green spaces and buildings. We've got quite a diverse natural environment here, from the kind of uplands in the north and east, lowlands in Salford and Wigan to the west, lots of rivers, canals and water bodies cutting across the city region, a network of trees and woodlands, and some grassland and farmland as well. So focuses across all of those different habitat types, but urban green spaces and buildings obviously really important for people's health and well-being in our towns and city centres. Next slide, please. Yeah, and so for each of those, it sets out priorities. So what we want to see happen, what changes we want to see happen on the ground. So these are just the extract for our urban areas, and you can see the link here between the strategy and, in this case, kind of healthcare settings, or where people can access accessible green spaces through public buildings, etc., and around their parks and green spaces as well. So health and well-being benefits embedded within what we want to see delivered as part of the strategy and the priorities that are set out within there. So moving on to the next slide, I want to talk a bit about kind of partnership working. The strategy was co-produced with a range of different partners, utility providers, housing trusts, catchment partnerships, environmental NGOs. So really a collaborative effort. Next slide. So yeah, it was co-produced with those organisations, local authorities, farmers and landowners, and then agreed and signed off by all of our 10 local authorities, as well as the likes of Natural and Forestry Commission and the Environment Agency. So a real collaborative effort. And it's already being used in terms of that informing strategic planning locally. It's informing the development of local plans in each of our local authorities. It will inform Greater Manchester Spatial Development Strategy, which will be developed later this year. And it's informing things that like our NHS Greater Manchester Green Plan as well. So it's informing the development of a range of other strategies and plans as well. And then finally, I was just going to talk about how we're transitioning from that collaborative preparation to delivery of the strategy. So the next slide just sets out the range of different ways that the LNRS can be used in terms of an evidence base, informing other people and other people's actions, supporting funding applications and the development of business cases, directing engagement and providing a way of engaging residents on nature recovery, starting to inform collaborative project development between our environmental NGOs, has a link to biodiversity net gain, and is helping us make the case for further resources to deliver the strategy and fill in some of those gaps as well. So we're using it, if you go to the next slide, to drive delivery across our partnerships, embed it in some of those strategies and plans I mentioned, identifying where some of the gaps in current funding of projects might be and where we need to do more, and also monitor and report delivery against those targets that we set out. So on the next slide, these are some of the things we're doing in this first year after publication. We're kind of mobilizing our partners and looking at how we're bringing people together to deliver on the targets. We've got additional funding that we're targeting into some of the gaps that we're seeing and to really drive delivery against those targets. We're developing things like delivery guides, supporting projects to be developed, supporting things like biodiversity net gain, and starting to think about how we promote some of this activity as well. And kind of leading into John's slides, we know that delivering on this strategy for us in Greater Manchester means a more livable city region, so better access to nature with that strong link to health and well-being. Will attract more businesses and business retention and more green jobs. Will improve our resilience to climate change. And if we do all of those things in the right way and in the right places as well, it will bring more of those benefits to those communities that need it most in terms of green space provision and access to nature as well. So hopefully that was a quick, helpful canter through of the development of the strategy and how we're implementing it. And John's going to talk a bit about more of the kind of practical delivery and the links between that and health on the ground. So over to you, John.
Thanks, Sam. So Andy mentioned green social prescribing earlier, but for those who may not be aware of what it is, a trained professional like a social prescribing link worker works with an individual to connect them with nature-based community groups and activities, thereby enhancing their mental and physical health. It provides a flexible, person-centered model, working as a supporting measure alongside conventional medical interventions and as a powerful alternative in its own right. It can include things like walking, community gardening, conservation, green gyms, open water swimming, and everything in between. Next slide, please. So, whilst I think modern medicine can do amazing things, the vast majority of the time, our health system is still structured to fix symptoms, not to address their root causes. 80% of patients presenting to their GP come with symptoms caused by wider determinants of health, issues that can't be resolved in a 10-minute appointment or a medical prescription. A clinical environment also comes with a doctor-patient hierarchy, which can be daunting for someone with stress and anxiety. In the natural environment, there is no hierarchy. Nature is uniquely non-clinical and non-stigmatizing. People are treated as peers and equals. Nature isn't just a nice-to-have backdrop, nor is it just a passive venue. We need to start seeing our natural environment as an active healthcare setting, an enabler of outcomes. When we improve a green space, we aren't just making it look nicer. We are performing a public health intervention that develops long-term healthy behaviors and a sense of belonging that is difficult to replicate in any other way. Next slide, please. So the Greater Manchester City region faces considerable health challenges and entrenched inequalities. In Greater Manchester, over 733,000 residents, which is 25% of the population, live in the 10% most deprived areas nationally, and this deprivation is acutely felt in health terms. It is in this context that Greater Manchester was well placed as a national test and learn pilot area as part of Natural England and DEFRA's National Green Social Prescribing Programme from 2021 to 2025. The initial phase sought to address health inequalities by scaling up delivery as much as possible. We commissioned 5 VCSE organisations to act as central hubs in their localities and began to embed nature into health policy. And through this phase, over 1,300 people took part in a nature-based intervention. Phase 2 was more targeted and smaller scale by design, comprising 2 parallel work streams. The first was a bespoke programme working with individuals with a serious mental illness, delivered through a partnership within Pennine Care, who are one of Greater Manchester's largest mental health trusts, providing programmes with several of their early intervention units. The second work stream was an intentional pivot to focus specifically on the most entrenched health inequalities, using hyperlocal data to reach into the 10% most deprived communities. Next slide, please. So I appreciate I'm probably preaching to the converted here, but if you weren't already convinced that nature is a public health good, here is our proof. We didn't just find that people felt a little better from our programs. We demonstrated statistically significant improvements in mental well-being. The improvements in mental health led to a peak net economic benefit of £4,933 per person. So, by using nature as a mental health intervention, we are bringing a significant financial benefit to society. But it is important to emphasize that this isn't just about abstract statistics and financials. It's also the stories of real people like Andy. When Andy joined his program through Pennine Care, delivered by Groundwork, he was out of work and struggling to get by each day. Through his weekly allotment sessions, he rebuilt his confidence and his social skills, and eventually his career. Today, he is back in employment, but he still spends his day off at the allotment because, in his words, it is my only reason to get out of bed. That is what a return on investment should look like. Good for nature, good for people, good for our economy. And by structuring the programs this way, 83% of our participants resided in the most deprived areas, and 76% were from ethnic minority backgrounds, achievements that are difficult to replicate through other large-scale programs and settings. Next slide, please. So you can't prescribe nature if nature isn't there, or if it's behind a locked gate, or if it feels unsafe, or if it's only accessible to the most healthy and wealthy. I see local nature recovery strategies as our physical and mental health infrastructure. If the NHS provides the doctors, LNRS provides the wards and the clinics of the future, our parks, wetlands, and woodlands. We need new and improved nature spaces, just like we need more hospitals and clinics. And to allocate these spaces fairly and equitably, and to ensure we're getting people into those spaces, we need cross-sector partnerships so that when a planner is looking to map for nature recovery, they also look at a map of mental health and deprivation densities. Once these things are in place, we can work with community organisations to ensure those spaces are being utilised effectively, that they're being looked after properly, and that they're contributing to a greater sense of community and well-being. A planner allocating accessible green space is quite literally performing a public health intervention. Next slide, please. So in Greater Manchester, we are undergoing significant structural change to our public services approach, moving away from short-term project-based funding cycles. The future of this work is through our Live Well approach. This is a mayoral commitment to ensure that every neighbourhood has a collaborative ecosystem where public services and the voluntary sector provide proactive and preventative support. It's being jointly led through a partnership approach between GMCA and NHS Greater Manchester and our VCSE sector. In addition to this, green health is now embedded in health policy, such as our primary care blueprint and our NHS green plans. It's included in our public health programme plan and our Live Well delivery plan. things that probably wouldn't have happened if it were not for the experiences gained from our Green Social Programme. Green health and accessibility are also an integral part of the LNRS for Greater Manchester, and it is baked into the principles of GMCA's Green Spaces funding, as well as funding available through our Live Well Communities Fund. So to finish, I hope this has given you a flavour of how we're trying to tie together and amplify the impact of our health environment, policy and strategy in Greater Manchester. There's lots more to do, but combining key policy levers in this way, through both the combined authorities and NHS integrated care boards, where priorities in the natural environment may come from different angles, but have many shared objectives, we'll be able to achieve lots more things for both the natural environment for its own sake, as well as for the health and prosperity of our communities. Thanks.
Thanks so much. Sam, John, that was so informative to see on a strategic level, but then also how the partnership is working with, I really liked hearing about the Live Well approach and, you know, the mayoral commitment and how important that is to really implement, you know, what is like a green health policy and how that can be integrated all across the board. So really excited to come back to that later. We'll be hearing from Stuart Gardner next, who's the Nature Recovery Manager at Bath and North East Somerset Council. So over to you, Stuart.
Hi, Sam. Hi, everyone. As Sam said, I'm Nature Recovery Manager at Bath, North East Somerset Council. But I led the development of the West of England Local Nature Recovery Strategy, and I'm still working on its delivery implementation for a couple of days a week. And I will explain what the West of England is because it's not a place that everyone is familiar with. Next slide again, actually. So just for a bit of context, the West of England is, for some people, the old county of Avon. It's basically Bristol and Bath and its surrounding areas. So the UAs of North Somerset, Bath, North East Somerset, South Gloucestershire and Bristol. The responsible authority for the production delivery of the LNRS is the West of England Combined Authority, which somewhat confusingly covers 3 of the 4 unitary authorities, but not North Somerset at the moment. Next slide, please, Sam. So this is what our local habitat map looks like. And something to note, I guess, compared to Greater Manchester and West Midlands Combined Authority, obviously those do both have non or rural areas, but the West of England is quite a mix. We've got at the centre a big city in Bristol, but we do also have quite rural areas. So there is that mix of rural and urban, which not every local nature recovery strategy has. And that was a bit of a challenge in terms of how we approach the LNRS. And we have slightly different approaches to those 2 areas, which is definitely relevant to what I'm talking about today. So don't need to spend too much time on the map. If we go forward a couple of slides, Sam, and I'll talk a bit more about how we approached health in a local nature recovery strategy in particular, before going on to talk about what we're doing at the moment in terms of delivery. So obviously local nature recovery strategies, the primary lens is nature recovery, as it says on the tin. But as DEFRA told us, and as obviously we wanted to do, we did want to have a quite strong focus on improving nature, richness, engagement, climate resilience in urban areas, and bring all those benefits that people have been speaking to in this webinar. So in those urban areas, we focused on those things: how to bring people closer to nature, how to improve climate resilience, and we particularly tried to focus with the mapping on how we could do that or prioritize that in more deprived communities and those with the least access to nature at the moment. I'll show you some of the written priorities and measures relevant to this in a minute, but just in terms of the mapping of measures, we only mapped measures kind of relevant to urban areas in public and semi-public spaces, so largely parks and green spaces, but also, for instance, hospital and university estates. And the logic for that was partly based on where things would have the biggest impact, but also the way the LNRS is structured in planning and is using biodiversity net gain, we felt it appropriate to focus on those areas and not map areas across, say, private gardens and private spaces. In terms of how we produce the LNRS, and I won't go into all the details, but we worked closely on the nature and health stuff, both with our unitary authorities, but also with the West of England Nature Partnerships Nature and Health Group, which I'll talk about this a bit later in the presentation, is very active and has been very active on nature and health, but also with community representatives, particularly those of some of the more deprived communities in Bristol in particular, but also other areas. In terms of what the LNRS didn't focus on, we didn't look at things like green social prescribing, which I know John was talking about earlier, and things like measures to improve access in parks in terms of the infrastructure, for instance. And obviously that's not because it's not important, but we didn't feel like that was the remit of the local nature recovery strategy. And there's a lot of good work going on in that area, but just wasn't included specifically in the LNRS. Next slide, please. Next slide, please, Sam. So our statement of biodiversity priorities, we split it into 6 themes. The first 4 were very much nature focused, and the 6th was around species, but the 5th was about people and nature. And you can see in that list of priorities, that we've got things around making our towns and cities more nature rich, more wildlife rich, but also people having better access to nature spaces, particularly in areas that are more deprived, more trees in towns and cities, more opportunities for local food growing, which we think is really important for food and for people's health and well-being. Again, we've probably covered all of that already, and then adaptation to climate change. So again, reflecting a lot of the stuff's been said today in terms of what's important for people's health in this context. Next slide, please, Sam. Again, I won't go into loads of detail on this, but this is just an example of how one of those priorities broke down into written measures. So the kind of things you might expect around more space in parks, public spaces managed for nature, new parks and green spaces to meet the needs of development. And that's something I'll come on to on delivery, because we do have a lot of development in the west of England. And obviously all of those priorities have a list of measures there. Many of those aren't mapped because of their nature, but things like increasing areas of parks and public spaces managed for nature are mapped to where those are. And that enables local authorities, for instance, to access that biodiversity net gain uplift for those measures, which we thought reflected the fact they had that benefit for health and well-being that other interventions outside of urban areas wouldn't do. Next slide, please, Sam. I mean, it's a bit of a slightly hard slide to pick this up potentially in terms of how detailed it is, but this just gives a sense of the mapping of measures in urban areas. So it's just been kind of cropped to the urban areas, with the proviso that the urban areas around Bath does include the whole kind of Bathscape, the landscape around Bath, which is a lot more rural. But you can see here there are some areas, some larger areas mapped, which are not just important to people, but also for their ecological value. So we tried to kind of map a mixture of ecological corridors going through towns and cities to enable wildlife to thrive, to pass through, say Bristol, Bath, but also if you kind of were to zoom into Bristol, and obviously I won't do that here, you would see that there's more areas mapped in those more deprived communities than there are in some of the wealthier communities, for instance, in the West, where there's already very good access to nature and green space. Obviously, there's an exception there if there are areas in less deprived communities, but they're valuable for their ecological sake. And this can all be explored on our website. Next slide, please, Sam. I'm going to start talking about delivery now. And we published the LNRS back in November 2024. We were the first to publish. So we've had a bit of time to be thinking about this and start using the LNRS in anger. On the planning side of things, I mean, because we have 4 unitary authorities in the west of England and a combined authority, we're in a slightly not odd situation, but we're in a situation where we have local plans working at very different timescales. So the local authority I'm employed at, Baines, we have a local plan developing at the moment at relatively early stages. So good opportunity for the LNRS to influence. Others are basically at the examination stage, so less of an opportunity there. But where the local plans are actively in development, we're using the LNRS to inform those site allocations. So both in terms of where development will happen, obviously it's still at the have regard to stage, but the LNRS will be taken account of as of spring. But we've been quite proactive in making sure we are taking account of it already. But I think probably just as importantly, we're looking at using the LNRS to inform which habitats and which measures in the LNRS to prioritise on a given development site. So how can those developments both work in terms of ensuring people who live there have good access to nature and green space, but also how can they enable wildlife to travel through them and connect habitats around them. Something else we're looking at quite actively at the moment, and it's at relatively early stages, is how can we deliver strategic opportunities for kind of larger scale sites for access to nature, things like country parks that deliver local nature recovery strategy outcomes. And that's something in my local authority in Baines, Bath, North East Somerset, we're looking at very actively at the moment because of the stage of our local plan and the fact we don't have any kind of large country parks at the moment. So something that could give that win-win for LNRS and people is very much at the top of our minds. We're also at the early stages of developing a spatial development strategy, and that's being led by the Combined Authority. Again, the LNRS, as I think was mentioned earlier, has a key role in the development of that. It's at very early stages, but it's very much high on the list of things to be considered. Next slide, please, Sem. So in terms of delivery, we had the local nature recovery strategy, obviously, and through the Nature Partnership, which is the West of England Nature Partnership is acting as our delivery partnership for the LNRS. We've developed 9 priority programs to help translate the LNRS to delivery. So slightly more thematic, and we're taking a bit more of a place-based approach. But one of those programs is the Urban Nature Program, and that's effectively about enabling nature to recover and thrive across urban landscapes, both for the benefit of nature and for people. And this is very much an active program, bringing together local authorities, Natural England, some of the organisations involved in the Nature and Health Group and the Nature Partnership. And we're looking at enabling communities to act in nature, bringing nature closer to people, developing nature-based solutions to green infrastructure in towns and cities that increase climate resilience, which is, over the last couple of years, has really risen up the agenda, given the weather and the shifts in climate, and hopefully deliver a flagship project that will create kind of large-scale, wilder place, in urban areas. So this is building on a lot of existing work in this space. We're quite lucky. We've had a lot of active work from the Wildlife Trust, for instance, the Bristol Climate Nature Partnership, and this West of England Nature Partnership's Healthier with Nature program, more looking at nature and health. And there's a lot of very engaged communities who have climate and nature action plans, for instance. So we're trying to build on that, not literally, obviously, but to scale up these community initiatives and bring in more private funding and investment into green spaces in urban areas, because there's as I think, I can't remember who was showing the stats, I think it might have been Mike, around the benefits nature have to businesses, for instance, by reducing sick leave. There's clearly should be some demand there, and that's something we want to scale up in the West of England. It's obviously tricky, so we've developed a kind of local evidence base and developing a kind of communications plan that will enable this. Next slide, please, Sam. Because this is kind of part of a broader piece of work to develop a project pipeline that will deliver some of the key priorities, outcomes of the local nature recovery strategy, and securing investment in nature-based solutions. So this is probably I'd say the most important bit of work in terms of our delivery of the LNRS is we want, as the Combined Authority, I'm working on their behalf for a couple of days a week, want to support projects that deliver LNRS priorities, deliver additional ecosystem services like climate adaptation, like benefits to health, to move from inception to delivery. So support them through that process. And we have a few active projects and programs already that are getting towards, hopefully, that stage of being more private funding investment ready. Probably the most advanced is resilient Froome, which is in the bottom left. So that's a partnership between South Gloucestershire Council, Bristol Council, Wessex Water, the Environment Agency and other partners. And the Bristol Froome runs kind of from north of Bristol in the rural catchment to through Bristol to the Bristol Avon. So there are businesses, there are communities there who will be exposed to flood risks and opportunities to bring people kind of closer to the river and the nature alongside that. So that's a kind of hopefully the kind of project that might beget private funding and investment in catchment scale initiatives to improve flood management, water quality, people's access to nature. And there are conversations with potential investors and funders in that space. In kind of more rural catchments and on my patch in Bath, North East Somerset, we have a Connecting Catchments project, which is at an earlier stage, but looking to develop vision priorities for 2 catchments, which have interest from the water companies or Wessex Water and Bristol Water there, who are partly funding the projects. And ultimately looking to develop a program of investable projects that, yes, deliver nature recovery, but also benefit people there in terms of climate resilience, adaptation, and in the Somer Valley in particular, there's a lot of development coming that gives challenges, but also gives opportunities to have investment in nature and make sure those communities are properly embedded in nature and have good access to good quality nature for their health and well-being. Next slide, please. Just got 1 or 2 more left. This is, I mentioned earlier that kind of green social prescribing we treated as outside the scope of the LNRS, but I just wanted to flag that this is something we've been working on very actively in the west of England. So I used to manage a nature partnership, and at that point we were at the earlier stage of a nature and health program, but we developed a nature and health strategy for WEMP, and then were one of the I can't remember how many pilots, a few pilots for green social prescribing in the country. So that program secured, I think, 1.7 million of additional funding and funded over 90 nature and health projects across the region. And that was really focused on, green social prescribing, created a kind of healthier with nature directory to enable people to better access opportunities to engage in nature and those green social prescribing opportunities, and created a still live community of practice of health and nature practitioners that are delivering those kind of more targeted interventions in green care and green social prescribing. So that's been really positive. There's a bit of a challenge in terms of how we then get to mainstreaming this and secure its legacy, because the national funding has ended. So I think there are bids going on, but that transition from the kind of a project to something that's mainstreamed is tricky, but it's something this region is very active on. I'm not so closely involved with, but I thought I should definitely flag it. And then last slide, Sam, just to talk about our kind of future plans. And I think I have really mentioned most of these things, but some of the priorities, we obviously need to be very active in terms of the spatial development strategy and making sure the opportunities in the LNRS are reflected there. And I think that the Mayor very much sees that as a key piece of work that will reflect the priorities of the West of England Growth Plan. I mentioned those opportunities for nature and people, particularly in the green belt. I should mention there is a kind of planning requirement in the new NPPF called the Golden Rule, which mentions making sure development positively contributes towards nature recovery in the green belt. So, and people's access to nature in the green belt. So we've got a lot of green belt in the west of England. I think over half of it's green belt. So there are big opportunities there potentially to secure investment from development to give people more access to large nature-rich spaces. I mentioned the investment in nature-based solutions for climate resilience being very much high on the agenda. And then the Urban Nature Programme I talked about, there is a funding platform that's being developed, similar to a couple of examples in, say, Cornwall. So a platform for community projects to access funding, crowdfunding, etc. And so hopefully unlocking some of that potential private funding. We're looking at nature towns and cities accreditation for the region and the benefits that will bring. And then that kind of campaign and communications piece to really get across the benefits of bringing nature closer to people, green infrastructure, nature-based solutions in towns and cities, again, to try and incentivize that investment that will unlock those benefits. So hopefully watch this space, and in the next year or two, we'll have some more money coming in to develop the outcomes of the local nature recovery strategy. I'll stop there, Sem. Thank you.
Thank you so much. You're so insightful. I'm just going to quickly hand over to Andy for a few words on that.
Yeah, thank you very much, Simon. Thank you, Stuart. There was a question on University Challenge last night, which was what's the name of the river that runs mostly underground through Bristol? And if only I'd seen your presentation first, I might have come straight in with the River Frome and actually got a question right on University Challenge for the first time. It's so sad that it came in that order. But I just wanted to reflect very briefly, Sam, on the presentations we've had so far, because they have brought to life so beautifully how local nature recovery strategies can be put into practice. And some really great real life examples of the delivery tools that can be used to make sure that LNRSs are actually strategies that are leading to change for nature with all those other multiple benefits. I was at the launch of the West of England local nature recovery strategy quite some time ago now, wasn't it, Stuart? And what was particularly striking there was for me anyway, was the local ownership, the fact that the leaders, the leading politicians, the chief executive of the local authorities were all very present and really owning the local nature recovery strategy and seeing the importance of it in delivering a better quality of environment for that area. And I think that's really critical to making sure that LNRSs are delivered, is that local ownership by those kind of key high profile individuals. And I know it's the same in Manchester with Andy Burnham being a very key advocate of this as well, and the same in the West Midlands as well. So I think that is an important part of the process, is the buy-in from those people who are the big decision makers in those authority areas. And I thought what Sam and John did really clearly was demonstrate the full circledness of this, if that's a way of describing it, that investing in nature is creating all those benefits to the local economy, and the example that John gave in terms of green social prescribing, the benefits to nature and the savings, the sort of financial benefit of doing that is just one outcome that I think really then helps make the case for continuing to invest in nature. And I think the examples we saw today did that beautifully. So Sam, shall I just hand straight on now to Warren Lever, who is the Principal Spatial Planner at Hampshire County Council.
Thank you, Andy. Thank you, Sam. Can you all hear me okay? Just double check that's all working. Yep. That's brilliant. Okay. So first slide, please. Yeah, thanks. Well, thanks for inviting me to talk. My name is Warren Lever, for those who don't know me. Principal Spatial Planner in Public Health, the Healthy Places team in Hampshire County Council, planner and urban designer by background, and part of a split role at Hampshire County Council, well, two full-time roles. One is a transport planner and myself as Principal Spatial Planner. So we work both in the planning side of things and also in the transport side of things. Next slide, please. So I'm going to talk a little bit about our approach, which is very much about health in all policies, but it's also about health in all opportunities. It's great to talk to people about having that sort of thread running through, but sometimes opportunities pop up in the work we do, both internally and externally. So it's about that as well. I'm going to talk about how we cover both work within Hampshire County Council, more strategic work, and then I'll work with our wider local authorities. We have 11 districts and boroughs to work with, so quite a few stretching across Hampshire. But building those relationships, which is really important in terms of how influencing planners and other place-based professionals, and not just about the standard planning approaches, a little bit more than that. So next slide, please. So we're fortunate to have a JSNA that is map-based in Hampshire. It's got a number of different sort of profiles within it, but it's a really good tool for us in terms of looking at the whole of Hampshire. These are the maps for access to green space in Hampshire. So it gives us a picture of the whole of Hampshire, but it does allow us to delve down into that sort of fine grain element of Hampshire for each different district and then for individual LSOAs as well. So it's a good map-based assessment. It indicates a direct correlation between what others have said about a reduced access to green space and those areas of greatest health inequalities. So our work tends to prioritise in those particular areas because we know that's where we need to have the greatest influence. And many of these places lack large green space projects as well. So it's often about trying to influence in other ways around that sort of thing. We often tell people about access to green space and we tell them about the benefits and we sort of talk about what the benefits to health are, but it's very difficult if you live in an area that has limited or no access to green space to be able to sort of do that, particularly alongside other social economic. You might be working 3 jobs, you might have a lack of access to car, public transport. So all those things layer up to sort of make that sort of inequality a little bit greater. Next slide, please, Sam. Sorry, shameless pop culture reference here. I think it's for us, it's one thing about providing data. We can point people to the JSNA, we can tell them about the data. But for us, it's very much about how we sort of help local authorities understand that data, how we take the sort of raw data elements of it and shape it to a bit of a picture. So a particular project or a particular policy can be crafted a little more, bit more strongly, particularly in relation to sort of green space, open space, and nature recovery. Next slide, please, Sam. So just internally, we build lots of relationships across lots of different bits of Hampshire County Council. Key teams like Countryside and Public Rights of Way teams obviously help to talk about things like access and inclusion, as well as the local nature recovery strategy. We have other policy documents that sit alongside that. So we're involved in the Countryside Access Plan, also involved in the biodiversity report that we've just produced at Hampshire County Council. So we tend to think of a broad landscape approach to these things, which I think helps that sort of joining up and trying to find some continuation across lots of different bits of the work we get involved in. So we also get involved in internal work through a natural environment steering group at Hampshire County Council, and then ongoing work with our transport team. Next slide, please. Might feel odd to talk about transport and green infrastructure, but certainly for us, it's one of those tools that we have about sort of increasing accessibility and increasing accessibility for those most vulnerable. Our local transport plan 4 has a health, climate, and green infrastructure thread running throughout it. So that's a new transport plan for us, which talks about things that are beyond maybe the traditional transport plans would do. We're also running a healthy street training and building healthy streets into our frameworks. And that's about thinking about how access and movement for those more vulnerable users of towns, cities, and places can be enhanced. And there is green infrastructure as part of that policy, improving streets. So both our capital programs in terms of transport infrastructure and also our work on policy and projects have green infrastructure built within them as part of that. Next slide, please, Sam. So just a quick talk on local plans. We tend to work with lots of authorities at early work on local plans with the evidence base through the JSNA and other frameworks, Natural England Green Infrastructure Framework. We'd look to talk about health-focused policies in those areas where there are the greatest health inequalities. And it's about aiming to influence policy ambitions such as health and green infrastructure, climate and air quality. We are now seeing positive green and blue infrastructure policies, and we're now seeing local plans consider landscape as a structural element of climate and of sites and approaches. So for a long time, some local plan policies treated landscape as a buffer or a screen, or it was there for green, I suppose, green value. But actually what we're trying to do is get those local plans to think about them as climate and health networks, as well as sort of landscape networks. Next slide, please, Sam. We do a lot of work on neighbourhood plans. These are really important bits of the planning framework. These tend to work at local neighbourhood levels and often have quite a bit of influence in terms of local neighbourhood plan areas, can have a lot of influence in improving things like green infrastructure networks, access to green space, improving green space. Sometimes they include additional green space that's being created locally within that area. So again, we often see some really innovative policies, and sometimes the policies in local plans are sometimes, I'll say this, a little bit more innovative around green space than they are maybe in local plans. I suppose the one drawback of this is we have very few neighbourhood plans in those areas of greatest health inequality, and that's probably an issue in inequality in itself. So probably a gap again there for us. Next slide, please, Sam. In addition to that work, we tend to get involved in conversations around lots of other green space strategies. Now, these could be local green infrastructure strategies, it could be open space strategy, it could be playing pitch strategies. So we're working with those to try and get them to think about those green spaces, not necessarily as solely as whatever that particular function is, but the wider function. So conversations around playing pitch strategies around sort of how climate resilient those are and what else they can add beyond just the playing pitch. We are seeing a number of urban areas in Hampshire, and this is probably a picture that's going to be nationwide, that have a deficiency of green space. Alongside new 5-year housing land supplies, I know at least 2 of our authorities possibly looking at that inequality increasing. So again, it's about working with them with their policies about where else they might be able to pick up that green infrastructure focus in different policies in local plans and other projects. Next slide, please, Sam. Some people have probably seen me talk about this. I often talk about stewardship projects. Lots of planning deals with new stuff, so stuff around the edges of places and new developments. But often we get involved in an area of priority work for us, which might be around sort of things like town centre regenerations. It could be public realm strategies. It could be estate regeneration. So those get us into working in existing areas, and often in existing areas of greatest health needs. So again, it's a really positive for us to think about bringing the JSNA data along with us as an evidence base, and then putting a local health lens on plans and delivery. Big parts of a lot of those are about improving access to green space, particularly in areas that are quite deficient, and enhancing approaches to design of green space and climate resilience. And also in some of these about access, gender equity, improving accessibility and inclusion, safer streets and spaces. So working about sort of how these spaces can be safe and accessible for all people in local communities. Next slide, please. Our work on planning applications, we get consulted on large-scale planning applications. There's a threshold we set within a planning position statement, which allows us to get involved in sort of more strategic applications. And again, it's often embedding approaches to landscape and green space as a structural part of a site, rather than sometimes, as probably happened historically, landscape was done at the last stage once they decided where the roads and the buildings were going to go. But again, trying to encourage that more strategic approach. And it's good to see in the new NPPF that actually that site assessment and that assessment of schemes for landscape approaches is being strengthened. We tend to talk about those sort of co-benefits of climate, health. This is not just a health perk. I think lots of people have said this prior to me, is that this is a really embodied sort of approach to habitat, climate, health, and it can be character as well. Use of things like the National Design Guide, and again, we're using that healthy streets approach in new developments, about sort of trying to make sure streets aren't just conduits for cars and bin lorries. They provide a little bit more in terms of places and green infrastructure. Next slide, please. So again, just in terms of, it is possible to make greener streets. We do often see a lot of the picture on the top left there, but actually we are seeing much more in the way of sort of developments that start to embrace that green infrastructure. Next slide, please, Sam. In some spaces, these are the limited green space opportunities. And as you can see, in terms of habitat and contribution to green space, they're not great. And we can do better at this, both for landscape, nature, and as you can see with these two, inclusion and variety. Next slide, please, Sam. So I thought I'd just pick up on this small scheme just outside Winchester. This is Lovedon Fields and Kingsworthy. It's 50 new dwellings arranged around a green space and a green lane embedded within the wider open green space, and a wildflower meadow that sits alongside it. The public realm sort of encourages interaction and community, strong landscape approach, doorstep benches, overlooking roof terraces, and calm shared services. And you'll see schemes within the picture bottom left there is actually an attenuation pond within the scheme, which has been turned into a really sort of attractive central space within a particular square. Next slide, please. As well as commenting applications, one of the things we are trying to do is talk to planners directly. So we've been trying to work on training planners in things like Building for a Healthy Life and different approaches to planning. So actually we're talking directly to the planning officers and those dealing with applications, maybe to help embed it in the work they do and make it more natural decision rather than it just being a piece of paper or PDF that flies in from public health, which is another consultation they've got to read. So again, working in partnership with those local authorities, and a lot of these frameworks now sort of really talk about green space, both at that strategic planning level of sites, but also within sort of the detail of streets and places and courtyards. Next slide, please, Sam. One particular project I might talk a little bit about, and again, this is at a smaller scale, but really valuable. We've been doing lots of work around designing for ageing populations. Hampshire County Council has a care home programme, and as part of that, we've worked on internal guidance based around the Happy Guidance, which is a design-led approach to sort of improving spaces for older people. Again, within that, it's trying to avoid what's happened historically, which is maybe a rather institutional approach to care home design, which are the two images at the top there, but maybe a more informal sort of landscape-led approach to both buildings and spaces in the bottom there. So that's been really positive internally with Hampshire County Council, but we're also advising local authorities that are looking at provision for ageing populations about how they might include facilities around sort of Happy Guidance for care homes, but also lifetime neighbourhood approaches, which again pick up on those key areas. Next slide, please. So I think that's it from me. We all know it's not always easy to do this. It does take lots of work. It's thinking about lots of opportunities where we can influence. But we feel like Hampshire's sort of taking steps to consider this more broadly. There's room for designing for both people and nature together, as Sem said previously. And I think landscape could become genuinely transformative for all communities. But really important, as many others said, is picking up on those health inequalities. How do we stop those getting worse in certain areas, and how do we seek to address that through the system? Thank you, Sam.
Thank you, Warren. It's so nice to actually see the different presentations and then work our way more sort of like on the ground implementation, how it works with the local plans, what are the sort of like levers that you have to your disposal as well. So thank you so much for sharing your presentation, Warren. If I can invite the speakers, I think we've still got John, Stuart, Warren, Anna. If I can also invite you to have a little discussion as part of the panel. I've got a few questions because I thought just given the different scale and context that everyone is working in, how difficult that has been in terms of a transition. I wanted to ask everyone if there was a difficulty. I know some people are sort of like new to it, but then also have seen the development of it. I wonder if everyone could share a few words on that. Andy, I'm going to start asking from you, if that's okay.
Yeah, I mean, I think what we've seen so far has been fascinating, really, and I think it's just the art of the possible. Really, I think there's been some really good examples of actually how LNRSs are being embedded into the planning policy. But I think there is a difficulty because of the challenges that are upon spending and upon land use at the moment. So it'd be interesting to see whether the colleagues who have presented so far have experienced any difficulty or resistance from working with their colleagues within their own authorities in actually putting these plans into practice, in raising the profile of LNRS is actually sort of in that very competitive space, really, for airtime for initiatives and ideas that are coming forward. Because I think Natural England, we are living and breathing local nature recovery strategies. We've had a very important role to play in making sure that they are rolled out. But that's sort of dealing them always within one particular program. Whereas when you're working for a local authority, as I used to, I know that you have got many competing demands upon your time and upon your budgets. And therefore finding the space for LNRS must be difficult. So I think, Sam, that's the question I would be sort of most interested to hear the answer to from the colleagues who presented so far about some of those challenges or any tricks or tactics that they've employed to make sure that those multiple benefits from LNRSs are being realised.
Stuart, Warren, I'm going to hand over. Who wants to go first?
Go on, Warren.
Sure. Yeah. I was just thinking about two challenges and in response to that. I know when we started our roles at Hampshire, there is sometimes misconception. I know talking to other healthy places colleagues in that, well, health and wellbeing, that's all about. It's about takeaways, isn't it? And active travel. And I think we've done a lot of work internally where there was a little bit of that, shall I say, to talk about how broad health is and how it is really important in terms of things like green infrastructure and planning. So I think, yes, that is difficult, and often you get you will sometimes get the maintenance thing. I think that is a real issue sometimes. Particularly, we've had probably challenges around sort of our highways network about sort of that balance of providing green infrastructure, but actually the maintenance of that green infrastructure as well. So I think there's probably a couple of difficulties there, and then probably the other one I might mention is the poor old development management policy planners of districts and boroughs, their time capacity and I suppose bandwidth to try and consider all of these things, that are supposed to consider in a planning application. I think that is a real barrier. They've lost lots of resources over the last few years, had lots of iterations of the NPPF thrown at them from left, right, and centre, legislation changes as well. So I think we do try and take an approach where we talk about, I think I said it a few times, about that sort of co-benefit policy. This isn't just us coming and talking about health. This isn't just us coming to talk about transport. These things are very intertwined and very important that we do all of these things. I think that's been, I don't know. I mean, some planners might think we're a bit of a sort of, I don't know where they feel we're a bit of a pain sometimes we come and talk to them, but I think that's been received much better as policy that does lots of things than just a silo approach. Sorry.
That's really helpful, Warren. Can I ask either to yourself or to others on the call who've presented so far about the financial benefits? How much do local decision makers need to see sort of the pounds and pence equation of investing in nature, realizing actual savings in other aspects of public service delivery? Is it important to be able to present it in a way that you can evidence with financial savings, or is the narrative, is the case already just so obvious that nature is good for the quality of life of people who live in your area that we don't need to spend hours trying to sort of present spreadsheets to demonstrate that actually it does stack up in terms of the payback as well financially?
Just quickly, I think that's really important. Sorry.
I was just going to say, no, I was just going to bring in John, because I felt like your statistics around sort of the net economic benefit per participant in your program, statistics like that, I thought were really, really powerful. And I wonder, maybe John, both of you can sort of reflect on that. Like, is it statistics like that could be really helpful if you could share, the impact ultimately, but from an economic standpoint?
Yeah, I think from our perspective, the nature-based interventions aren't new, are they? And there's so much data out there that says that it works, it's good for people's health, it's good for society, it's good for a whole different host of benefits, including the economy. But for some reason, I still don't see that translating into actual kind of decision makers and policy makers really jumping on board with it as fully as they could do. I think for us, having that evaluation specifically for Greater Manchester, it does provide a bit more influence and a direct, tangible translation of what it means for the local area. So that's really helpful. But even still, despite that, it is still a challenge to kind of present this sort of information and to talk about these sorts of programs to health commissioners. I think there's so many challenges across the system at the moment. Investing in what is still seen, if I'm quite honest, kind of nice to have programs like community nature-based interventions is still a challenge. That said, I think all of this work is coming at the right time, particularly for us in Greater Manchester. From a health perspective, we've got the NHS green plans, which are a statutory requirement now, and those chime really well with the health focus of the sustainability plans across the NHS estates. And then there's also a significant push toward prevention and preventative care from a national perspective, but also across the Greater Manchester region as well through our Live Well plan. So all of this work on the back of the Green Social Prescribing Programme nationally, and then the implementation of LNRS as well. I think all of these things just work together to kind of support this work and to provide a more sound case. But as I say, even though we've got the data to show it still works, there's still challenges in actually translating that into funding to flow down to those community groups in particular, who are the ones that provide those interventions to people and also the natural environment.
It kind of it reflects back on like Stuart's presentation as well, just on the importance of, you know, the evidence base and then making the case for that private funding, whether it's private or public. Stuart.
Yeah, I'm just building on that. I think we're very good. It's easier to make that kind of theoretical case that, say, nature has this benefit to businesses in terms of reducing sick leave, for instance, or has these theoretical health and well-being benefits. It is much more difficult to translate that into investment because, say, from a local authority perspective, for instance, we know all these benefits, but that doesn't necessarily translate into our budgets. You know, we know the public health benefits, but that doesn't necessarily directly reduce the demands on adult and social care for us. And generally at the landscape level, if we're trying to get private funding and investment in, for instance, then those figures don't really cut it. You need to kind of come from a almost demand-led way of thinking about things, and this is what we're finding when we're talking to people from finance and businesses. You know, what is their reliance on the landscape, for instance, and how can they actually invest in something practical like an nature-based solution, or in an urban area, green infrastructure around their business that would benefit people. So I think trying to more directly, tangibly relate a potential piece of funding investment to the benefits to that person, business, organization, whatever, can be much more impactful than kind of theoretical values. That's much more difficult when it comes to things like public health, obviously. And I think there are barriers in terms of the way, say, the NHS allocates funding, which is beyond my realm of expertise, and I don't have the answer to that.
It's really helpful to hear that, though, and that sort of direct feedback from how it feels within your authority areas. I think there is a message here for us who are a bit closer to government to see what we can do to try and help that to join up across government. As I said earlier, Natural England is part of DEFRA, and clearly we get our steer from the Department of the Environment, but it's increasingly important for us to be working with other departments like housing and local communities, like health and transport, to try and at that government level to sort of see how investing in nature can actually help deliver their priorities. So we're doing that increasingly, and I think that join up needs to come right from the top, doesn't it, from central government through to regional and local authority level as well, to try and help with that being that challenge you just described, to sort of being recognised right at the outset and seen as an opportunity all those through the different tiers of government. And I think that's perhaps where myself and Natural England colleagues can really help, I think, to try and make that case so that you're not having to start that case locally. It's actually something that is coming through government and being set in those national policies and strategies.
I just wanted to quickly jump back to Warren, if you sort of just back to that point about the local need as well, because I think, Andy, I wonder whether actually there's a real importance top down as well as bottom up on all of these points. Warren, are there sort of specific things that could really help you implement that or connect the health and nature points within your local context? What are those evidence points from your perspective?
So I think Andy's original point about sort of that value bit, I think that is really important for local members. I think it's about how that's, because we do the spreadsheets, but it's probably about how that's told as a story. Probably, I think, maybe more than necessarily just facts and figures. Particularly for, I certainly think the health angle, particularly for local members and decision makers, is really important. Health of communities, I think they really value that in terms of those things. And then the other thing on value I was going to say is that value to save. You know, that's I dread to think how much local authorities spend around the country on things like, for example, highways infrastructure, particularly in light of what's happened recently, that, you know, this long sort of periods of rain. You know, if somebody could quantify that and work out actually if when you'd have done your highway scheme or your development, you just spent X more on the landscape or green infrastructure, you may have avoided this happening. So I wonder if there's that sort of, actually it may not always be a cost. It actually might be a transfer of money to another to another thing that actually has a benefit and improves green infrastructure. Does that make sense? Sorry, in terms of the damage to roads and highways is really expensive to keep maintaining, and actually green infrastructure could be a real ally in that.
On that note, just there's an example in Oxfordshire actually. I think they've provided some funding for natural flood management initiatives to reduce flooding on their road network. Which is I'm interested in more details in terms of how they've come to that agreement and how they can the confidence in terms of the benefits it will deliver, I guess, is the challenge.
Yeah.
Yeah, Anna, do you want to go in?
Yeah, I'm just listening to this conversation and thinking, I think from it's been incredibly inspiring and so exciting as well to hear about all of the great stuff that's going on. And I hear from you all, and I see in the chat as well around the sort of, this is definitely challenging, and there are barriers. I think one of the things we note from a national perspective and with our relationship with the 48 local nature recovery strategies, and it was a theme that came up in the event that Andy Smith referred to earlier, where we brought the local authorities together with some of our local nature recovery strategy staff, is that they really benefit hearing from this kind of best practice. And four local authorities have been, it's not been just a kind of random set of four authorities we've brought here that are doing LNRSs. We know you're doing great things, and there's some great practice to share. So it's brilliant that we're having this call and this. I think it's easy to sort of understate the real value of just you being leaders amongst your peers about how this can be done, and fueling each other to keep working through the barriers, sharing the evidence. Some local authorities, I guess, will have more capacity to generate evidence than others. So that's something I think Natural England's really keen to keep doing, is in our role across this whole agenda, is do what we can to help share that best practice around. But we need the best practice examples to come forward. So yeah, just adding that into the mix in terms of next steps and ways forward.
I think that's a really important point, Sam, if I may say so, because in the chat there are one or two comments saying that it isn't all rosy, and we understand that. We know that there are some big challenges, and not all local authorities are starting in the same place. So DEFRA and ourselves are definitely not stepping away from our work now that we've helped support the publication of LNRSs. And the feedback we've had has generally been that support has been really helpful and bringing people together, sharing best practice, having the local Natural England colleagues on the ground in the local areas working with their responsible authorities to help get the LNRSs out there. But we do realise that the publication of the strategy is only one thing, and all the sort of great work to embed LNRSs in the things that we've heard about today is the big challenge and where the real gains are. So we will be continuing to support at that local level. DEFRA are absolutely determined that these LNRSs will lead to a step change in terms of nature recovery and the benefit that will lead to people's quality of life. So we will continue to support wherever we possibly can, and to do the kind of best practice sharing that Anna just mentioned. So we know that it's just the start really now.
Thanks, Andy. We did have plans to break out, but since I think there's some really interesting questions from the audience here, so I wonder whether we just extend our panel and Q&A to the end of our session today. And I just wanted to start off by going to the chat and just working my way through the questions. But there's a question here to ask about, can we use the opportunities of changes to the planning system to help us embrace a more circular economy approach to excavation waste from building sites to better benefit nature? For example, instead of diverting excavated clay to landfill, could you direct it to provide natural lining for pond and lagoon creation? I wonder if who would like to tackle that. I loved the circularity conversation as well, because I think that's also very important.
I think we're all looking a bit like maybe not my area of expertise. We are so I guess isn't as much of an LNRS thing as it is a local authority thing for us, but we are looking at how we can strengthen our policy, and it's not quite this, but it is related. In terms of soil management and construction, there was an example in the west of England. I won't go into details of it, of a development that's had quite a significant impact on a river because of soil loss from the development, and that's related to how the management of the soil on that development. So that is something we're looking at to avoid any future issues, and that wasn't in Baines, that issue, but potential issues there. And I noted it in the chat, but the challenge there is, again, it's having the policies is one thing. Having the capacity to monitor and enforce them is very different. And I think Warren was saying that is a real challenge in terms of having capacity within our planning teams to do that. So in a way, I mean, the NPPF does provide more of a challenge around policies because we're slightly constrained by national policies. But I think that's as much of a challenge is the monitoring and enforcement for that kind of thing.
Excellent. Warren.
Yeah, it's not a key area of my expertise. Certainly, though, I suppose there's a couple of things just raised up. I don't think currently the planning system allows a strong response to that circular economy reuse of materials that would support it. I have seen a number of, shall I say, climate policies and climate frameworks that talk about reuse of existing build materials on site, and I've also seen a few which talk about sort of reducing things like cut and fill. So you're not losing carbon and you're not having lots of stuff scraped off sites that is going to be dumped somewhere else. So there are a few policy tricks around that, but I think it's a really good idea, and it would be good to see as climate becomes a more a stronger consideration within the NPPF, whether the local authorities feel they have the confidence to write that into, if there's design coding or further design work that goes on beyond the NPPF within individual local authorities, where they could start to look at that.
I don't have anything else clever to say about this particular question because it's definitely not my area of expertise, but the question reminded me of something else that's come across my desk, which was an idea in Natural England for us to be supporting and facilitating and matching. You have to bear with me to see the link between what I'm going to say and what's just been said. But anyway, some of you will get it, and others of you can just enjoy it, whatever. The idea of Natural England matching volunteers who want to do good stuff with nature recovery projects. The idea that came forward. Apologies, some loud people just walking past me. The idea was particularly around tree planting and hedgerow creation, interestingly. But it was someone in Natural England has clearly sort of seen a gap that delivery of those kind of enhancements struggle to find resources. And I suppose where my brain is seeing the link is that there's something that we'd all, I guess, a lot of us would love to see happen, which is that connections are made between the different things needing to happen. So volunteers who are keen to do stuff being matched with initiatives that need volunteers, or in this case, particularly hedge planting. So in the same case, I sort of was thinking, Owen, that, I guess there's a non-policy solution to this too, which isn't there, which is someone who's digging up loads of clay, spotting that there's someone else in an initiative that would like some clay. So I don't know I don't have an answer to how we help make that happen, but it will be interesting to see the extent to which some of that emerges from the partnerships that have been talked about today that are being pulled together, partly to deliver local nature recovery strategies, but to be delivered the range of other related environmental and nature activities that are being planned. So there you go, there's my food for thought.
Excellent. Thank you so much, Anna. I think that, there's a lot here in terms of the influence that local nature recoveries could have. And it is, I agree with you in terms of it, perhaps it is about, the sort of ripple effects of some of the partnerships that are being brought together and the work and the programs being generated from it. On to the next question, which it's a bit of a thorny one, but are we at risk of presenting LNRS wearing rose-tinted spectacles? The key barriers to delivery have not really been identified, which may threaten the good work. Our LNRS paper tigers, where taking account has not really been addressed, and the lack of resources, human and financial, to translate these visions into reality. As a planner, I see the LNRS glass half empty and cracked. I think this might be, I might be wrong in assuming this. This might be from a planner, and there have been sort of discussions with planners that I've had as well, who are a little bit nervous around this. And I wonder if Warren, if I could ask for your opinions on just reflecting on that point.
It's difficult. I mean, it's just a tricky one to just trying to work out from that thread so I suppose the key question was. There are, I think, as I've highlighted, there are issues. I think we all recognise there are issues in areas of inequality. I think we sometimes recognise, and I'm happy to be shouted down this, that sometimes some of the big, so you say, local nature recovery strategies, projects are in areas that already have quite a bit of green infrastructure. And I think for me, sometimes I suppose for the last 20 years, I've been banging on about improved green infrastructure in urban areas of deprivation. But yet I've never seen a major strategic funding pot or maintenance pot that's maybe a town or a place in one of those areas could actually apply for, to say, well, we want to green up our town centre. We really want to put in some proper green infrastructure because we have very little or none. I've never seen a project that does that. So I think maybe in terms of the stuff that falls through the gaps, I do sometimes worry that those existing green infrastructure inequalities may not get resolved. But I'll be happy for others if they've got ideas of other projects that have done that, or where funding might come from for that, or government funding. And again, there's that health link of improving people's health. Lots of people, Mike said a lot about this, didn't he? Before he was sadly cut off. Just about how we work in those areas, I think, because there are some areas, I'll be honest, there's some areas in Hampshire which will look after themselves. They already have lots of green infrastructure. They have well-resourced green infrastructure projects, and often they are in areas where there is already a lot of green infrastructure. So I think that for me is probably sometimes where it's difficult. And then the planning side of things, it is as a plan on the ground, it is sometimes a battle to get that green infrastructure into some schemes. Lots of other pressures, and this is pressures on developers, so it's not always their fault to deliver lots of things on a site. And then sometimes that green infrastructure does sometimes get squeezed out a little bit, becomes a tricky thing. I hope that I'm not sure that answers the question, but there are some things there, I think, and it's for us to work on, isn't it, over the next next cycle of planning and approaches, both government and at local authority.
Yeah, I think that's such a important point, Warren, because we've had so many discussions about some of the conflicting areas, but also at which scale can you actually provide a really impactful intervention. And I just want to also bring back John's presentation as well, because I think it's really important to see a little bit wider than sometimes the local authority perspective, because there are some really, really amazing work being done because of that NHS collaboration as well. Anna, I'm going to pass on to you on your point.
Thanks. Yeah, I mean, as well as I kind of acknowledge this point earlier in what I was saying, and Andy has as well, and will come in, but clearly, yeah, clearly there are a lot of challenges. I sort of inferred that this was around, I think inferred that this was around lack of resources, human and financial, picking up on that bit of the question. Clearly, LNRS and none of the things that we're doing are all the silver bullet that are unlocking everything and making this incredibly easy. There isn't some place that has got this all licked, and the system is incredibly complicated, and there are challenges in all manner of places. But I think for me, the LNRS, the changes to planning, the new duties that are coming in, do create opportunities, and it's right that we sort of clock them and promote them and encourage each other to think about what we might achieve and what could be done. It's not going to achieve revolution, is it? We're going to evolve, and our ideas are evolve, and we'll keep coming together and sharing our experience about how we break through things. I'm very interested to work with my colleagues, and then so I work on a local nature recovery strategy as my day job. So that's been where my focus has been, but really keen, and we'll be working with colleagues in Natural England on the land use planning side to just think really carefully and clearly about how we can support local authorities with the limited resource that we have, but to really take best advantage of LNRS. So, absolutely, there's a lot of challenges, but hopefully we can all put our best foot forward and work through them.
Yeah, just to come on the back of what Anna said, I think, and I understand the premise of the point that's been made in the chat by Alistair about the lack of resources and the challenge of actually putting LNRSs into practice, and that we mustn't sort of see it as all great and rosy. Do appreciate there are some challenges, but I think for me there is a frustration that in terms of perhaps how LNRSs might be perceived, and because there's a duty to take account or have regard to LNRS in decision making, it could be seen as a bit of a burden or yet another thing to take into consideration. Whereas actually LNRS is, because of all the work that sits behind them, all the work that perhaps many of you on the call have been involved in bringing together that local engagement to give it the credibility of what really matters locally, where the opportunities are, where the biggest benefit is going to be by investing in nature. I think that makes them a really helpful tool that has saved lots of people lots of work in the future by having to look at that evidence every time a decision is made, or every time a plan is being drafted up. You've got a ready-made resource there in the local nature recovery strategy that reflects those local priorities and has got that local engagement behind it. And it should be seen as a really helpful super tool that can really help you make the right decision and get the best value from the decisions that are made locally. Another initiative that Natural England are involved in is the Secretary of State for the Environment has launched an initiative called the National Estate for Nature, bringing together some of the biggest largely public landowners in the country to just get on and do good things for nature on their land, to lead by way of example. And one of the principles in setting up this group was to have local nature recovery strategies as one of the reference points for the landowners to look at in terms of what decisions they make regarding the management of their estate. And initially the reaction from the people around the table was, oh yeah, that's another thing that we've got to look into. Can we just look at the key LNRSs rather than having to have regard to it every time? But through discussion, that discussion has flipped to see how helpful LNRSs can be at that very local level in making decisions about estate management, which are going to give the best benefits for nature whilst realizing other multiple benefits as well, and not compromising the main reason why landowners hold the land in the first place, whether it be for food production or housing or whatever it may be, but how nature can be part of the solution using the LNRS as a key evidence tool. So I think I'm talking to ourselves here at Natural England and DEFRA, but right the way through the system, I've got a job to do to try and sort of flip that perception and to use LNRSs as a really helpful guide to make good decisions.
Thanks so much, Andy. Stuart, did you have your hand up too?
Yeah, I mean, I think Andy pretty much covered my point. So, given time, you can crack on, Sam, if you want.
Not at all. Thanks, Stuart. So, in terms of, there's a really interesting next question from Dave Bell about this has shown me how local places are already working hard to join up various requirements and policies from central government. So local nature recovery strategies, joint strategic needs assessments, SDSs. None of these say they must align with each other. So what can we do working with government to make this join up easier? Thoughts? Anna?
On my electronic hand. I mean, my immediate reflection, having worked a bit with DEFRA, is that I think there's always a political nervousness about musts in anything. So I think we have to be realistic about the extent to which what governments think they're doing by giving flexibility to allow locally tailored solutions and for people to work in a way that kind of makes most sense locally. That said, as Andy said before, that we in obviously Natural England and can be definitely making the case for making sure that the alignment of these things works really seamlessly. So it is easiest when it gets to the sort of more local level for that join up to happen. Yeah, and I don't mean that to sound like a cop out, and it definitely isn't meant more. And I think the pause in my voice is I'm thinking, what is that? Are that maybe you all have other thoughts about how at the local level we can make that join up easier, things that would help unlock it. We've obviously talked a bit already about the sharing of evidence. I'd be interested in other thoughts on that point.
If it's okay, John, I'd like to bring you in because I feel like your experience is all about sort of like bringing that collaborative work together. Yeah, so if you're able to reflect on the question.
Yeah, I think. You hear me okay?
Yes.
Okay. I think it is a challenging one, and whilst all of these policies and strategies are great to have in isolation, bring them together to make sure they talk to one another and that they're aligned, it does create issues, and it's not perfect. I think also enforcing that is incredibly difficult. It muddies the water even further and creates even more of a challenge. I think from our perspective in Greater Manchester, within our organisation, we've got a sustainability working group where we liaise with all of the different NHS trusts and localities across Greater Manchester to align projects and work and priorities and share learning as well that's happening across all of the different areas. And I know that GMCA have an LNRS working delivery group as well, which is similar, but from obviously the focus is on LNRS, but it includes stakeholders from all across the different sectors, different localities, etc., to align and to make sure that we've got the right things included in there, that the projects that have been identified are right for those areas and that they're delivered in the best way possible. And I have to say, being kind of in that group throughout from the implementation of LNRS at the very beginning, it's been done really well. And I think it's really coordinated and helped collaboration across Greater Manchester from all of those different areas. Not saying it's perfect, and obviously the focus is on LNRS and how that gets rolled out and dovetails into other strategies and policies. But I think it's a really good approach, and yeah, it's something that could be modelled. But I don't, like I say, I don't think there's a quick win or an easy answer to that. It's really comes down to collaboration, partnerships, relationships, as things always do. But the fact that the LNRS is there, and it is, I think, at least kind of a centerpiece of policy that other strategies and policies should feed into or have regard to, rather than the other way around. At least gives us a starting point to kind of look at that work and then decide how best to integrate it with other strategies and stuff that's happening across other areas. I don't know if that made sense, but yeah, it's about relationships, isn't it, and partnerships and doing what we can with the policies that we've got. But I think it's a good place to start.
Excellent, thanks, John. I think it just highlights how like early on, and also when we're taking a relational approach, it's the same as like any relationship. These things take time to establish, and we're trying to pull together like a national way of moving or a direction, and it's not going to be perfect from the get-go, and actually there will probably be a level of iteration on top of establishing these strategies as well. Did anyone have any final comments on that point just before we do final words? Andy?
Well, not on that point specifically, Sam. I think as far as this call has gone today, I think it's been enlightening, inspiring, and from sort of central perspective of working for a government agency, it is really uplifting to see how things are happening on the ground, and that sort of local ownership and initiative that's been used by colleagues on this call to put LNRSs into practice and to embed them in the way that they have been done. It's really sort of rewarding in a way to see that work paying off. But just returning to the event that we held in Leicester a few weeks ago, I think there particularly, and talking to colleagues from the responsible authorities, it was evident that there is a momentum to this work. And I know that there are some challenges and some issues that have been described in the chat and that we've covered on the call today. But it's quite clear that all that work that's been put in so far to get the LNRS to this stage, people want to see it actually lead to real change. So I think we've all got a role to play in making sure that happens. It would be great to know what we can do to help. So not necessarily now on this call, but you know who we are. So please do let us know if you think that Natural England can do something particularly, or whether we can feed anything into DEFRA to central government that would really help make that connection, particularly across government, which I think is one of the important challenges. One of the questions that George has put into the chat, I think, I don't know if we have time to sort of follow it up today, Sam, but asking if you would take one action in the next 3 months to connect your work to your local LNRS, what would that be? I think it would be really interesting to sort of hear some of the answers to that particular question. That might have to be for another day, but I think actually getting into that sort of really detailed action space would be really helpful, so that we are learning from each other as much as we possibly can do.
We can definitely send around some of the questions in a form when we send the link to the recording as well. I think that's a really good idea, Andy, in terms of just keeping the conversation going and being able to share best practice and things that are going on. I think there's been some great conversation about things that are happening on the ground and connecting, VCSE organisations with more the strategic side of things too. So really would love to keep the conversation going for sure, onwards from this call. I'm afraid that's all we've got time for today, but I suspect that many of us will want to continue this conversation for much longer. So as I mentioned, we had some prompts for our breakout sessions, but I'll put that into a form which we'll send out to all attendees. Our list for the attendees has been through the Health and Wellbeing and Planning Network. So if you are able to sign up to the network, we can then take that as a mailing list to send out to our colleagues. I will be also sending it out to colleagues at Natural England, so that we're trying to capture as many people as possible. And I'm hoping that kind of like captures everyone that wanted to and were able to join today. But before we close, I just wanted to say a huge thank you to all our speakers, Andy, Anna, Mike, Sam, John, Stuart and Warren, for sharing such rich and practical examples. I think it's given lots of people food for thought wherever you are working and within whatever strategy you're working in as well. Thank you also to Natural England, TCPA and everyone in the Health and Wellbeing and Planning Network who has really helped to bring this session together. A particular shout out to Gemma Hyde, Sally Roscoe, George Coombs, Amy Naffler and colleagues at Natural England. And as I mentioned, for those who aren't already, by the way, just checking, but can you hear me? Because I know it's a little bit like far. I've had sound issues with this mic, but for those of you who aren't already connected with the Health and Wellbeing and Planning Network, please do fill in the form that I've shared a link in the chat. We're a community, as I mentioned at the start, we're a community of over 250 practitioners working at the intersection of planning, health and wellbeing, and we'd love to have everyone that has been able to join today be involved because we're all about knowledge sharing, but we're an informal group wanting to have these conversations in a safe space ultimately, and really trying to share knowledge and good practice all across the board. The recording and slides will be shared, as I mentioned, to the network's mailing list, but then I'll share it with Natural England colleagues who can then disseminate it across their channels as well. If you have any follow-up questions for any of our speakers, I wonder if is it okay to give your contact details in the email that I will send out? to all those speakers? Nod,
yeah,
if it's an okay. Fantastic. So I'll share those contact details in the follow-up email. Thank you, everyone, for joining us today and for joining us this morning. Really, really great to have you here, and hope we can continue sharing good practice and just checking in with each other with how things are going as well. Thank you all.